So let's study Oshtha Gata Rogas from Ashtanga Hrudaya and Sushruta. Sushruta mentions 8 types of Oshtha Gata Rogas, whereas Ashtanga Hrudaya mentions 11 types. Sushruta mentioned the Oshtha Rogas in Nidhana and treatment in the Chikitsa Sthana, whereas Ashtanga Hrudaya mentions this in Uttara Sthana. And which are the Oshtha Gata Rogas mentioned by Sushruta? 8. Vataja, Pittaja, Shlishmika, Sannipatika, Raktaja, Mansaja, Medaja, Abhighataja or Kshatraja. Ashtanga Hrudaya mentioned 3 more, that is the Khandoshtha, Jalarbuda and Raktaja. So these are the 8 by Sushruta plus 3 by Ashtanga Hrudaya, Khandoshtha, Jalarbuda and Raktaja. And which are the 8 types of the Oshtha Gata? The 8 types mentioned in Sushruta are Vata Pitta Shleshma Sannipada, Rakta Mamsa Medha Abhighata, Tatra Oshtha Prakopa Nimittaha. That is, the 8 forms which affect the lips are either Vataja, Pittaja, Kaphaja, Sannipatika, Raktaja, Mansaja, Medaja, Abhighataja. The first we can see what is mentioned in Ashtanga Hrudaya Uttara Sthana, Vata Oshtha Gata. Oshtha Gata tu pavanat, stabda voshtau, maharuchau, dalyate, paripadhyate, parusha asida karkasha. So what is a distinct feature? A stabda oshtau, stiff lips. Pain is maharucha. Dalyate paripidya, there is a splitting sensation. Then parusha karkasha, rough and dry, and asida, blackish. So, stabda oshta maharucha, dalyade paripadyade, parusha asida karkasha. Sushruta mentioned karkasha parusha stabdai, krishna tivra rukhanvidai, dalyade paripadyade, hi ashtau maruda kopadaha. That means Karkasha, Parusha, Stabda. Karkasha dry, Parusha rough, Stabda numbed or stiff, and Krishna. What is the color? Krishna. In Ashtanga that is Asida, here it is Krishna. Tivra Ruk. The extreme pain is there. Also, Dalyade Paripidyade. The feels, the lips as if they are smashed, pulled out or cracked. And also, sorry, this is the Hi Ashtau Maruda Kopadaha. Sorry, Oshtha Maruda Kopadaha. So these are the Lakshana of Vada Oshtha Gata. So what is the difference between Ashtanga and Sushruta? Ashtanga mentioned Maharucha, whereas Sushruta it is Tivra Ruk. Same, but the term different. Asita and Krishna. Treatment. Mahasnehena Vadoshte, Siddhena Aktaha Pijurhitaha, Devadoba Madhu Jishta, Gugulu, Amara Dharubihi. So here the first treatment is Piju using Mahasneha. Mahasneha means 4 Sneha. Which are the 4 Sneha? Grida, Taila, Vasa, Majja. So Devadoba Madhu Jishta, Gugulu, Amara Dharu. These are cooked with Mahasneha and that is used for Piju in Vataja Oshtha Gata. That is the first treatment. Second is Pradisarana using Yeshtyaha Churna. Teneva Pradisaranam Yeshtyaha Churna Yuktena. Next, Nadi Swedam. Nadi Oshtam Svedaye Dugdha Siddhehi Eranda Pallavaihi. Milk boiled with Eranda Pallava or tender Eranda leaves. And the steam coming from this is used for Nadi Sweda. Third is Nasya and Tarpana. Gandaushta Hidam Nasyam Tasya Murdani cha Tarpanam. So Nasya mentioned in the Gandaushta as well as the Murdani Tarpana are also used. So what are the 4 treatment? Piju, Pradisarana, Nadi Sweda, Nasya and Tarpana. The next Sushruta. Chadurvidena Snehena, Madhujishta Yudhena cha Vadaje Abhyanchanam. So Abhyanka with Chadu Sneha plus Madhu Jishta. Second is Kurya Nadi Swedancha Buddhiman Vidya Oshtha Gata Shalvanancha Upanahe. So here they have not mentioned the specific liquid or from where we get the steam for Nadi Sweda. They simply mention Nadi Sweda plus Salvana Upanaha. Third is Mastishke Chaiva Nasyecha Tailam Vadaharam Hidam. So there is a Nasya and Shiro Vasti using Vadahara Taila for the Vada Oshta Koba. Then fourth, they mention the Pradisarana. Sri Veshtagam Sarjarasam Suradaru Sugugulu Yeshti Maduga Churnantu Vidyat Pradisaranam. So Pradisaranam using Sri Veshtaga Sarjarasa Suradharu Gugulu and Yeshti Madhu. So what is the difference? The difference is only the term Mahasneha, Chadu Sneha. Also in the ingredient. Sushruta mentioned Madhujishta only, whereas Ashtanga Hrudaya, Devaduba, Madhujishta, Gugulu, Amaradharu, etc. Then secondly, Ashtanga Hrudaya mentioned Pradisarana, whereas Sushruta mentioned as the fourth. Then Nadi Sweda treatment, Dugdha Siddha Eranda Pallava, but they have not mentioned Nadi Sweda only. The liquid is not mentioned. Nadi Sweda plus Salvana Upana. Shiro Tarpana is also mentioned. Next, Pitta Oshta Koba. Pitta Tikshna Asahau Pidau Sarshabhagrade Bihi Chidau Pidaga Bihi Behukledav Ashapago. So Pitta Tikshna Asahau. It is not able to tolerate heat or touch. Pidau Yella Sarshabhagrade. Mustard seed Agradi, shape, eruption, Pidaga. Then Bahukleda, highly fluid filled, also Ashupaga, means separate rapidly. What about Sushruta? Achido Pidaga bihi tu Sarshabhagradi bihi Brisham, Sadaha Paga Samsravo, Nilo Pido Chapitada. Here there is a color. What is the color mentioned? Neela Pido, blue or yellow. Then Sarshabhagradi Pidaga. Then Daha, Paga, Srava. Daha means active. There is a burning sensation, rapid ulceration of suppuration and the parallel discharge. So what is the difference? Tikshna Asaha, whereas Sushruta mentioned Daha. Then the color Neela is also mentioned by Sushruta. Bahukleda Srava, Ashtanga Hrudaya mentioned Ashu Paga. Then the treatment for the Pitta, Rakta, Abhighataja, Oshtha Gata Rogas. And the first we can look, the first treatment by Ashtanga Hrudaya, it is Pitta Abhighataja Oshtau Jalarbuda Bihi Upajaret. So first is Rakta Moksha using Jalarbuda. Second is Rodra Sarjarasa Shaudra Madugaihi Pradisaranam. Second is Pradisaranam using the Rodra Sarjarasa Shaudra Maduga. Third is Guduji Yeshti Patanga Siddham Abhyanjane Gridam. So a grida is made using Guduji, Yeshti, Patanga, and with this Abhyanga is done. Next, Pitta Vidradi Vacha Atra Kriya Shonidaja Abhi. So the next is Pitta Vidradi. All the treatment mentioned in the Pitta Vidradi is also done here. So Rakta Mokshana, Pradisarana, Abhyanga, and Vidradi. Pitta Vidradi Chigalsa. What about Sushruta? First is Pitta Rakta Abhighata Jalarbuda Bihi Upajaret. Here also the first is Rakta Moksha treatment. Second is Pitta Vidradi Vacha Abhikriyam Kuryad Asheshadaha. So all the treatment mentioned in Pitta Vidradi, that is all Samshodhana and Samshamana treatment mentioned in the Pitta Vidradi is also done here. So first is Rakta Mokshana using Jalarbuda. Next is Samshodhana Samshamana treatment mentioned in the Pitta Vidradi. Okay, so all these are related to lips only. So what is the difference? The Sushruta mentioned specially, Sushruta, Samshodhana and Samshamana mentioned for Pitta Vidradi, and Ashtanga Hrudaya mentioned more treatment. That is the Pradisarana and Abhyanga is also mentioned. Rakta Kopa. Raktoba Srishtau, Rudiram Sravadaha, Shonida Prabhu, Garjura Sadrasham Chatra Kshine, Rakte Arbudam Bhavet. That is Raktoba Srishtau, Rudiram Sravadaha. There is a bleeding. Shonida Prabhu, the lips look like color of the bright red color of blood. Garjura Sadrasham Chatra Kshine. So after the bleeding stops or decrease, the limbs will be exactly look like Garjura, date fruit. Garjura Sadrasham. And if this is left untreated, it results to the formation of an Arbuda, Rakta Arbuda. Sushruta mentioned Garjura Falavarnabihi, Pittagabihi, Samajidau, Raktobasrishtau Rudiram Sravadaha, Shonida Prabhu. Again, here also Garjura Falavarnabihi, color of the Garjura Fala, the Pittagabihi, Samajidau, Raktobasrishtau, Rudiram Sravadaha, there is a bleeding, and Shonida Prabhu, similar like the color of the blood. So, what is the difference? There is the Garjura Phala mentioned. Only the Phala term is mentioned extra. And the treatment is same as Pitta Oshtha Gata. Next, Kaphaja. Kabat Punaha Shida Asahau, Guru Shunau Savarna Pidigachidau. So, here Shida Asahau means it is intolerant to cold. And swollen. Shida Asahau, Guru, heavy, Shuna, swollen, Savarna Pidagachidau. That is the eruption will be Pittaja will be same color as that of the lips. What about Sushruta? Savarna bihi tu chiyade, Pittaja bihi avedano, Kandu mando, Kabachuno, Pichilau, Shidalau Guru. Savarna bihi, same like the color of the lips. Then Pittaja bihi avedano, no pain is the. Kandu mando, itching is the. Kabachuno, Shuno means swollen, Pichila, slimy, Shidala, cold to touch, and Guru, heavy. So the difference is Shida Asaha, Kandu Manda, Shida Pichila, Avedana. The treatment. Idameva Nave Karyam Karma Oshtetu Kaphaduri. Same initial treatment line, such as a bloodletting, should be applied to an acute or newly formed lip disease caused by Kapha dosha. So first line of treatment we studied in Pitta was Raktamokshana. That is, should be done first here. The next. Padakshara Madhuvyoshehi Hrudasre Pradisaranam. So after Hrudasre, after bloodletting, we do as Pradisaranam using Padakshara Madhu and Vyosha. Kaba Oshtha Gata. Sorry. The next is Dhuma Navana, Gandusha, Prayojasha, Kabachidaha. The next we do the Kabahara, Dhuma, Navana, and Gandusha. So, what are the basic treatment? Raktamokshana, then Pradisarana, Kabahara, Dhuma Navana, Gandusha. Sushruta mentioned Hridaya Rakte, Prayoktavyam, Oshtha Gata, Kabatmage. Again, first it is mentioned Rakta Mokshana. Second is Shiro Virejanam, Dhuma, Sweda, Kavala Eva. So, Kabahara, Shiro Virejanam, Dhuma, Sweda, and Kabala is mentioned as the second one. Then Pradisaranam, Trayushana, Swarjigaksharo, Yavaksharo, Vidamtada, Kshaudra Yuktam, Vidhadavyam, Medaja, Pradisaranam. Second is mentioned Pradisaranam using Trayushana, Swarjigakshara, Yavakshara, and Vidam. Also mixed with Kshaudra or honey. So, what are the treatment? Rakta Moksha, Kabahara, Shiro Virejana, Virejana Dhuma, Sweda, Kabalam. And the Pradisarana using Trigadu, Sarjikakshara, Yavakshara, Vitlavana mixed with honey. So the difference is in the Dhuma Navana Gandusha, whereas Shiro Virejana, Virejana Dhuma, Sweda, Kabala. Also Pradisarana drugs, there is a slight difference. Sannipada Oshtha Gata. Sannipada Danekabo, Agasmat Mlanam, Samshuna Rucha, Durganda Srava Pichilo, Vishamapagi. So, Anekabo, multicolored Pittaja will be the Agasmat Blana, Samshuna Rucho. So, Agasmat Blana, suddenly pain fades. Then, Samshuna Rogas, suddenly swell up. So, suddenly the eruption and pain fades, suddenly swell up. Durganda Srava, foul smell and discharge. And slimy, Pichila, Vishamapagi, uneven or irregular suppuration. What about Sushruta? Sagrat Krishnam, Sagrat Pidau, Sagrat Shvedau, Tadhaivata, Sannipadena Vijnayena, Anega Pedagachita. So sometimes Sagrat Krishna, what will be the color? Black. Sometimes Pida, Sagrat Pida. Sometimes Shveda, white. So this color dynamically change at interval. Sagrat Krishna, Sagrat Pida, Sagrat Shveda. Then Anega Pedachita means mixed variety of multiple Pittaja or eruption will be there. So, Agasmat Blana, Agasmat Samshuna Ruja is in Ashtanga Hrudaya, whereas Sushruta mentions Sagrat Krishna, Sagrat Pida, Sagrat Shveda. Mansaja. Mamsa Pindobamau, Mamsat Syatam, Murchad Krimi, Kramat. Mamsapindobhavam means look like lumps of raw flesh or meat. Then Murchad. When it is separated, what happened? Increased. The krimi will become right. So Murchad, krimi, kramad. Same in Sushruta, Mamsa Dushtav, Guru Stula, Mamsa Pindavat, Udkadav, Jandavashchantra, Murchandi, Sakasya Ubhayado Mukha. So Mamsa Pindavam also mentioned here. Also there is a Guru Stula, lips heavy and thick. And Jandu, Murchandi, Jandu, Krimi will come. Sakasya Ubhayada, from where? It will drops from both of the sides of the mouth. Through both of the mouth angle. Ubhayado Mukha. So, Guru Stula, Ubhayado Mugad is the key term here. Medaja Oshtagoba, Tailaba Shvaidu Kledo, Sakandavo Medasa Mrudu. So, Tailaba, how the lips like Taila, oily or greasy. Then Mrudu, Shvayadu will be the swelling, and Kledatum also will be the accumulation, like oily accumulation. Kandu with itching. Sushruta mentioned Medasa Ghruta-pindavat, Kandu Mando Stiro Mrudu, Acha Svadiga Sangasham Asravam, Sravado Guru. So Medasa here Ghruta-pindavat means a surface layer of melted ghee. There we mention Ashtanga Hrudaya Thailam, but here it is Ghruta-pindavat. The glossy and shiny, looking exactly like the surface layer of melted ghee. Then Kandu with itching, Stira Mrudu. Stira means firm, Mrudu means soft, and Achasvadiga Sangashasran. So, what is the discharge? It is Acham, clear, like watery, transparent watery discharge. Also, lips will be Guru. So, the main difference is Ashtahardha mentioned Tailaba, whereas Sushruta, Ghruta, Mandaba. Also, Achasvadiga Sangashasrava. Now, the treatment are Svedana, Swinnam. Next is Binnam, Bhedana, Vimetaska. Means it is excision, removing excess fatty mass. Agni karma, dahet medajam agnina. So the fourth is Agni karma. Pradisarana, Priyangu Rodra Tribhala Makshigaihi Pradisarayet. So Svedana, Vedana, Vimedaska, Agni karma, and Pradisarana. What about Sushruta? Medaja Svedide. So first is Svedana, second is Binne, Vedana, third is Shodide, Shodana. Fourth is Jvalanohidaha, Agni Karma. And also, next, Priyangu Tribhala Laudram Shaudram Pradisaranam. After that, we do the Pradisaranam using Priyangu, Tribhala, Laudra, and honey. So, Svedana, Bedana, Shodana, Agni Karma, and Pradisaranam. And Vimedaska is mentioned here. In Ashtanga, there is an excision. Whereas Sushruta mentioned Shodana. Pradisarana, Rodra, Ashtanga Hrudaya, whereas Lodra in Sushruta. Kshadaja. Kshadaja avadhiryade, padyade, cha asagrit punaha, gradidav cha punaha syatam, kandolav dashana chadav. That means there is Kshadaja avadhiryade, padyade. Means there is the tearing and splitting. Asagrit punaha. So repeatedly there will be tearing and splitting. Then Grandhi, lumps are knotty and lump formation. Also Kandulav, itching. What about Dashanachada? Dashanachada is another term for lips, that which cover the tooth. Whereas Sushruta mentioned Kshadajabhav, Vidhiryade, Padyade, cha Abhighataja, Gradidav cha Samakhyad Oshtav, Kandu Samanyudav. Again, Vidhiryade, Padyade is here. That is what splitting and tearing. Gradidav is also here. Kandu Samanyudav. There will be itching. Okay. Same treatment, same as Pitta Oshtha. Now, 8 Oshtha end. Now, next is the 3 addition by the Ashtanga Hrudaya. The first is Gandhoshtav. Vadena Oshtav Dvida Krita. So, the Vada split the lips into 2 parts. Treatment is Gandhoshtasya Vilikyandav Syutva Vranavatajarit Yeshti Jyotishmadi Rodra Sravani Sariva Ulpalaihi Padolya Kakamacha cha Tailam Abhyanchanam Pajit Nasyam cha Tailam Vadagnam Maduraskanda Sadida. Okay, So first is surgical procedure. First we are doing the snehana. Medicated oil to soften the tissue, then svedana, warm heat, slight heat, then legana, scraping, converting the chronic split into acute wound, then sivana, we are suturing the cut end, then Vranavat Ajaret. Post suturing care is Vranavat Ajaret. First we do the cleansing or Shodhana, gentle Shodhana, then Vrana Robana, wound protection medicine, then Vrana Bandhana, bandaging. So first we do the Sneha Sweda, then Lekana, Sivana, Vranavat Ajaret. Then we do the topical care, Abhyanga or massage. Topical care, Khandoshtha. What are the medicine used to prepare the oil? Yashti, Jyotishmadi, Rautra, Sravani, Shariva, Utpala, Padola and Kakamachi. So this oil is applied. Abhyanga is done. And here they have mentioned, I think one more treatment is there, that is the Nasya. How Nasyam, Thailam, Vadakna, Madhura Skanda Sadhisam. So Nasyam is also mentioned as the third one. Vadakna, Madhura Skanda Sadhyada. Okay. So have to add Nasyam using Madhura Skanda drugs. Nasya using Madhura Skanda Dravyas. That is also should be added. So one is surgical. Then after Abhyanga is there mentioned. Then also we have to report the third is Nasya using Madhura Skanda Dravya. Okay. Now next is Jalarbuda. Jalabudbudavat Vadakabad Oshto Jalarbuda. So Jalabudbudavat, it appears like a Jalabudbuda, water bubble. And what is the dosha composition? Vadakaba. So only two things, Jalabudbudavat Vadakabad Oshte. Treatment is Sakshaudra, Garshanam, Tikshna Bhinna Shuddhe, Jalarbude, Avaghade, Adivriddeva, Ksharo Agnirva, Pradikriya. So first, Bhinne Shuddhe, Jalarbude. First we are doing the Bedana and Shodhana. Then only what we are doing, Pradisarana, rubbing using the Tikshna drug. Sakshaudra, Garshanam, Tikshna, Jalarbuda. So Tikshna means we can use the Trigado. Then Avaghade, Adivriddeva, Ksharo, Agnirva, Pradikriya means if this is more deep-seated or if it is in increased condition, we have to use the Kshara and Agni Karma. So Jala Arbuda treatment, Bedana, Shodhana, Pradisarana, and for Avaghada or deep or that is Avaghada and Adivritta, we have to apply Kshara and Agni Karma. The last is Rekta Arbuda. Already mentioned Chatrakshine Rekta Arbudam Pave. That is if Rekta Oshta Kobe. When Kshina become what? Garjura Sadrasham. And if this Rekta Oshta Koba is left untreated, what happens? It leads to the formation of a tumor or growth or Arbuda, and that we call as the Rekta Arbuda. Okay, so these are the 11 types of Oshtha Koba, 8 type by Sushruta and 11 type by Ashtanga Hrudaya. Any doubts you can just post in the comment section, and for more updates you can like, share, subscribe my channel. Thank you.